All right, we're going to get kicked off. Good morning, good afternoon, and thank you all so much for joining us today. My name is Caitlin Cricco. I am the Senior Director of Enterprise Marketing for the Life Sciences here at Digital Science, and I am delighted to host today's session. The challenge for many medical affairs professionals is clear. How do we cut through the noise and transform massive amounts of information into tangible value? Our session today, from data chaos to strategic impact, transforming medical affairs in the digital age, is designed to answer exactly that. We will also leave time at the end for Q&A, so feel free to submit your questions throughout the session. In the next 30 minutes, you'll gain exclusive insights derived from interviews with medical affairs leaders across global pharmaceutical enterprises. Our speaker will reveal 4 critical success factors that separate high-performing teams from the rest. You'll learn practical strategies on how to prove strategic impact to leadership, how to overcome those persistent technology adoption challenges, and ultimately how to transform your overwhelming data streams into a competitive advantage. I have the great honor of introducing today's speaker, Mary Ellen Bates. I've had the privilege of working with Mary Ellen for many years now, and I know she'll make this an excellent webinar filled with clarity and practical advice. Mary Ellen is the owner of Bates Information Services, providing invaluable business research to professionals and consulting services to the online industry. And for a fun fact, she, her dogs, and her bees live near Boulder, Colorado. Mary Ellen, thank you for sharing your expertise with our audience. The floor is now yours.
Thank you, Caitlin. I'm really excited to talk about the insights that I gathered here. So over the last few months, I've spoken with publications managers and medical communications specialists and market analysis experts and medical affairs leaders to understand the challenge that they're facing and, more importantly, what's working. And I saw some really clear patterns, both in the obstacles that teams are facing and the strategies that separate the high-performing teams from those that are struggling, honestly, with digital transformation. So let's get into it. Start by setting the context. Medical affairs has undergone a dramatic transformation over the last several years, as you know, all of you have probably lived through. The role has evolved from what it was traditionally a support function for what I would call and into what I would now call a strategic business powerhouse. Today's medical affairs professionals are expected to be different. We're expected to be high-level advisors, evidence synthesizers, impact demonstrators, and business influencers all at once. And then COVID hit and everything changed overnight. Before the pandemic, I think most teams relied heavily on in-person interactions with their healthcare professionals. So they used paper-based materials, they had established workflows that had been refined over years, and then suddenly all of that had to go online. And this isn't just a shift in tools. It was a fundamental transformation in how medical affairs operates. New digital engagement channels opened up, which was great, but they also require teams to master entirely new tools, new workflows, measurement strategies, and often without the time or resources to properly train or adapt. What's fascinating is what I heard repeatedly in my interviews. One industry analyst told me, she said, we're hungry to understand what peers are doing. And that hunger, that need to know if you're keeping pace, if you're falling behind, if there's something you're missing, that came up again and again. So this tells me something really important. Everyone is navigating uncharted territory here. The most successful companies aren't necessarily the ones with the most resources or the fanciest technology. They're the ones who've learned to transform this challenge into competitive advantage through smart, tactical use of modern methods and evolved measurement strategies. So what's the reality that teams are facing today? I would describe it, as the headline here says, as content rich, but understanding poor. And let me explain a little bit what I mean. Medical affairs teams are drowning in information. There's vast, fragmented research literature coming from multiple sources. They're also monitoring multiple therapeutic areas simultaneously. They have diverse stakeholders, everyone from publications managers to medical writers and market analysis teams. And each group needs different types of information synthesized in different ways. And of course, they're trying to do this with limited resources. One publications manager that I spoke with put it perfectly. I've got a team of 7. For something like the obesity medication, we've got 2 people working on it because it's such a big thing. And my thought on that was 2 people trying to manage all of the literature, the publications, and the analysis for a major therapeutic area. That's crazy. And the challenge isn't about accessing information anymore. We're way past the challenge of finding it. The real challenge now is synthesizing overwhelming data streams into actionable insights. It's about turning all that content into actual understanding that can drive both research excellence and organizational value. So what we see is resource constraints forcing difficult prioritization decisions every single day. So which therapeutic area is going to get attention, which publications get prioritized, which stakeholder needs take precedence. Meanwhile, expectations from leadership continue to grow because that's what happens. So given all that, I don't think it would surprise you that I heard 2 challenges being mentioned in virtually every single conversation that I had. And these really feel like universal obstacles that cut across organizations, regardless of size or therapeutic focus. The first of those is proving impact. And I heard this question over and over again. How do we know that we're making the right impact? Medical affairs teams are being asked to demonstrate their value to leadership in concrete terms. They need to show ROI, especially these days. But here's the problem. They also need to maintain rapid timelines for clinical findings dissemination. They're trying to balance speed with meaningful measurement, and that is genuinely difficult. How do you slow down enough to measure properly while still moving fast enough to meet publication deadlines and Congress schedules? The second universal challenge is technology adoption. And this is particularly frustrating because it's not about a lack of investment or intention. I heard story after story about sophisticated tools that simply failed. And one expert shared this experience with me. We created dedicated dashboards for impact analysis, very nice dashboards set up for their therapeutic areas, but they weren't using them because it wasn't integrated into their common workflows. And I mean, think about that for a minute. The technology worked. The dashboards were well designed, but users abandoned them anyway because they didn't fit in with how people actually work. So this taught me something really critical. Integration beats innovation every time. I'm going to say that again. Integration beats innovation every single time. Success is determined far more by user adoption than technical sophistication. You can have the most advanced tool in the world, but if it requires people to change their entire workflow, they won't use it. So these 2 challenges, proving impact and technology adoption, set the stage for the 4 critical success factors that I'd like to discuss with you. So based on my research, these are the factors that consistently separated high-performing medical affairs teams from those that are still struggling. And I'll preview them for you here now, and then we'll dive into each one in a little more detail. So the first one is organizational change requires sustained commitment. You can't treat digital transformation as a one-time project. Second is impact measurement is a universal challenge, And the solution is collaboration rather than trying to solve it alone. The third, as organizations grow, coordination becomes exponentially harder. And that also creates opportunities for the right technology solutions to address that kind of coordination. And fourth, workflow integration determines whether technology succeeds or fails, far more than the sophistication of the technology itself. So let's look at each of these critical success factors in a little more detail. So the first one, again, is about organizational change and why it requires sustained commitment. Here's what I learned. Digital transformation isn't a one-time project. It's not something that you launch in January and you declare complete by March. One expert explained it to me this way. Everyone has a user adoption period. It needs time and education for people to get used to new tools. And then what he said, something else that really resonated. People always go to what they're used to and what helps them on a daily basis. I mean, just think about your own behavior. You know, when you're under pressure, when deadlines are looming, when you're overwhelmed, what do? You revert to what's familiar, right? You use the tools that you're always used to. You follow the processes that you know by heart. This is just human nature. It's why organizational change is so difficult, because when push comes to shove, we revert to what's familiar. So the key insight here is this: adoption is a process, not an event. Successful digital transformation requires recognizing that change takes time, as does planning for that time. So, and providing, sustained support throughout the entire journey, which is longer than, the January through March time period. So, what does this mean practically? It means you need to budget for training, not just initial training, but ongoing support. It means you need champions within your organization who can help their colleagues adapt. It means you need patience, and you need to set realistic expectations with leadership about timelines, because again, this isn't just a one and done endeavor. The organizations that succeeded were the ones that treat change management as a core competency, not a temporary initiative. I want to say that again. The ones that succeed treat change management as a core competency, not a temporary initiative. They're living with it. The second critical success factor addresses that first universal challenge that I talked about before, and that's impact measurement. Remember that question that I kept hearing: how do we know if we're making the right impact? It came up in conversation after conversation. It's clearly top of mind for medical affairs leaders everywhere. And here's what's interesting. When I dug deeper, I found that many teams were trying to solve this problem in isolation. They were reinventing the wheel and starting from scratch, trying to figure out measurement frameworks on their own that were going to work in their context. But the successful teams took a different approach. Their solution, and this may sound simple, but it's powerful. It's leverage the learnings from other internal teams and field colleagues rather than solving the measurement problem in isolation. So what does this look like in practice? It means talking to your counterparts in other therapeutic areas within your organization. Ask them what metrics they're tracking, what's resonating with leadership, what hasn't worked. Find out from their mistakes to find out what works, again, in your context today, as opposed to what might have worked a couple of years ago. It also means attending industry conferences and actually having those conversations with about measurement with your industry colleagues. Presentations, but actually connecting with your peers from other companies who are facing the same challenges, and see what has worked for them. And, it also, I was interested to see this, it also means looking at other departments within your organization, like commercial or market access, and see what they're doing to demonstrate impact, and see if any of those frameworks can be adapted for medical affairs. It may not be a strict one-to-one correlation, but see what kind of approaches they take that seem to resonate with leadership. And I think this collaborative approach serves two purposes. One, obviously, it saves you time and you're not starting from zero. So there's that. The second purpose that it serves is when you use measurement frameworks that others in your organization are already familiar with, it's easier to communicate your value to leadership because you're already speaking their language. You're speaking about impact in a way that they're familiar with from other people within your organization. Okay, the third critical success factor is what happens as organizations grow. And I heard this perfectly captured by one medical communications lead who said, we need to make sure that everyone is using our materials. We don't duplicate effort. This is easy in a small company, but it gets a lot harder when the teams are fragmented. Let me paint you a picture of what this looks like as this lead described it to me. So, you know, when you're in a small team, maybe you've got like 5 or 6 people and they're all sitting in the same office, coordination just kind of happens naturally. You know, one person creates a slide deck, everybody else knows about it, everybody uses it. There's no duplication of effort because everyone can see what everyone else is doing. But as organizations grow, you know, you add regional teams, you expand into a new therapeutic area, you acquire other companies. Suddenly you've got teams in different locations, working in different time zones, using different systems because that's what they have. And now that same slide deck might get created 3 or 4 times by different people who don't even know that the other slide decks exist. So this fragmentation obviously creates real problems. It wastes time and money, and that's a big deal. It creates version control nightmares. It means your messaging may not be consistent across regions, and it makes it almost impossible to have a single source of truth for your literature and your publications. But here's the good news, I guess. This fragmentation also creates significant opportunities for technology solutions. This is where AI-powered tools can genuinely transform how teams work. So when you think about where this could make a big difference, imagine tools that can perform literature gap analysis across your entire organization and then surface what's already been done so that you don't duplicate work. Or imagine rapid summarization capabilities that can help a team quickly synthesize large volumes of literature. Imagine accelerated synthesis processes that can dramatically reduce the time that specialists spend on just routine analysis. The technology to solve these problems exists today. The question is, are you prioritizing solutions that address coordination and fragmentation, or are you still trying to solve these problems through manual processes and like email threads? The fourth and the final critical success factor brings us back to that second universal challenge that I mentioned, which is the technology adoption. And you know, this is where I heard some hard truths. The lesson, clearly, just as simply stated as I can, is this: if it's not integrated, they won't use it. That was actually a direct quote from one of my interviews, and I just thought it captured something really fundamental about how technology succeeds or fails in medical affairs. So let me be a little more specific about what this means. So when you're evaluating new solutions, whether it's a literature management system or an impact measurement dashboard or an AI-powered analysis tool, the first question shouldn't be, what can this technology do? The first question should be, how does this fit into our existing workflows? I want to repeat that because I just think this is so important. When you're evaluating a new solution, Don't ask initially, what can this technology do, but how does this fit into our existing workflows? You need to evaluate the entire stakeholder adoption journey, not just the technical capabilities. So you've got to ask yourself, will my team members need to log into a new system? Will they need to learn a new interface? Will they need to export data from their current tools and import it somewhere else? Every additional step, every additional click, every additional system is a barrier to adoption. Here's a simple way to think about it. Integration is more important than innovation. Integration is more important than innovation. I'm not saying that innovation doesn't matter, of course it does, but even the most innovative tool can fail if it requires your team to abandon familiar workflows. Conversely, a simpler tool that integrates seamlessly into existing processes will succeed because people will actually use it. The most successful implementations that I saw were solutions that either enhanced existing tools that teams were already using, or that provided such comprehensive benefit that they could actually replace multiple existing tools and become the primary workflow platform. The takeaway was always consider the full adoption journey. Can choose solutions that work with your team habits, not against them. So I've covered the 4 critical success factors, and I'd like to talk just a little bit about what you can do with this information, how you can take these insights and transform them into action in your own organization. So I distilled these into 4 immediate actions that you can take, and I'll walk you through each one. So the first is assess, and that's take an honest look at where your biggest workflow friction points are. Where does work get stuck? Where do people complain most? Where are you duplicating effort? And don't assume you know the answers to those questions. Actually, talk to your team members. Ask them where the pain points are. You might be surprised by what you hear. Second, prioritize. When you're looking at solutions, choose ones that enhance your existing tools rather than replacing them entirely. Remember that principle that we just talked about, integration over innovation. So ask vendors to demonstrate how their solution fits into your current tech stack, and honestly be skeptical of solutions that require you to completely change how you work. Third is measure, but here's the key. It's track what matters to your stakeholders, not what's easiest to measure. So this means understanding what your leadership actually values. Is it publication counts? Is it citation rates? Impact on clinical guidelines? Speed to publication? You need to have those conversations up front so that you know that you're measuring the right things, the things that are meaningful to leadership. And fourth, plan. Remember that first critical success factor, change takes time and education. So build that into your implementation plans. Don't just budget for the technology, budget for training, for developing champions, and then for ongoing support. Set realistic timelines and, the evergreen advice, under promise and over deliver rather than the reverse. So these 4 actions, assess, prioritize, measure, and plan, can help you transform these challenges into competitive advantage for your organization. So to just wrap up, I want to leave you with this thought. The future belongs to those who transform. But what do I mean by transform? I've got in mind 3 specific things. And first, transform knowledge into understanding. It's not enough anymore to just gather information. Your value is going to come from synthesizing that information into insights that drive decisions. Second, transform content into strategy. So publications aren't just outputs to check off a list. They're strategic tools that can influence clinical practice, shape markets, and demonstrate your organization's thought leadership. And third, transform research excellence into business results. And this is the bridge that we've been talking about throughout this presentation. Your work needs to connect to organizational outcomes that leadership values and understands. So I guess I want to emphasize something important here. The tools and frameworks to do all of this, they exist today. You don't need to wait for some future technology to be invented. The question isn't about technology availability. The question is about execution and adoption strategy. So success comes to those who can make these transformations happen, who can turn their knowledge into understanding, their content into strategy, and their research excellence into measurable business results. So the insights and strategies that I've discussed can give you a roadmap for that transformation. The critical success factors that we covered, sustained commitment to change, collaborative approaches to measurement, solutions for coordination challenges, and integration first technology choices. These aren't theoretical concepts. They're practical strategies being used by high-performing medical affairs teams right now. And the opportunity is there. The question is whether your organization will seize it. So thank you very much. This presentation was based on the white paper that you see here, Empowering Medical Affairs in the Digital Age. You can get a link to download that white paper at the QR code or the URL there. You can also find other resources for medical affairs professionals at this portal, the Medical Affairs Resource Hub that Digital Science maintains. So Caitlin, back to you.
Thank you so much, Mary Ellen. This was a very insightful and impactful session. As always, a pleasure to host and present alongside of you. If there are any additional questions, feel free to reach out to Digital Science at any point in time. We'd be happy to walk you through any of our solutions that help our medical affairs professionals. And please download the white paper. I think there's some really critical insights in there that will really help you in your day-to-day work. Again, thank you, Mary Ellen. Thank you all for joining us today. And we'll be sure to get you a copy of the recording if you'd like to refer back to anything for your day-to-day work. Thank you, everyone. Take care.